I'm board-certified New York City plastic surgeon Dr. Darren Smith, and this is Plastic Surgery Before and After, your source for the real deal about plastic surgery procedures, news about trends in aesthetic medicine, and candid sessions with industry insiders. We hope you enjoy today's episode. What are some tips for a smooth liposuction recovery? Everybody does liposuction differently, so the tips that I'm going to offer here are specific to my patients and the way that I do things, but it can provide a useful framework for you to think about your own recovery and to ask your surgeon what he or she recommends for you. I generally advise my patients that if they have their liposuction procedure on a Friday, if they have a standard desk job, they can expect to be back at work the Monday after the procedure. Our rapid recovery program begins as soon as the procedure concludes. When you wake up from your liposuction procedure, or if your procedure was performed while awake or under twilight anesthesia, either way, you're going to get up and walk off the operating room table with assistance. You're going to be walking right away. And that's a very important part of the process because it gets your blood flowing again, it gets you breathing again, and it sets you up for an easy, healthy recovery. The other thing you're going to notice when your liposuction procedure is over is that you'll be wearing a compression garment. There's a lot of different information on the internet about what these garments do and how long you should wear them. And I really view these compression garments as having a primary purpose of controlling and reducing the amount of swelling that you're going to experience after the procedure. And as we generally find that swelling peaks at approximately 36 hours or a day and a half after the liposuction procedure, we advise that these compression garments are worn for 48 hours or 2 days after your liposuction procedure. We find that wearing these garments for longer than this is unnecessarily uncomfortable and doesn't really help all that much. One exception to the rule is if we're performing a skin tightening procedure at the same time as we're performing liposuction, then we'll have you wear your compression garment for a longer period of time. So we do recommend that you wear that compression garment for the first 48 hours straight after your procedure, which means you're not going to be showering or bathing for those first 48 hours, so it's probably a good idea to limit any social engagements, even though you may be feeling fine after about a day or so after your liposuction procedure. So at the 48-hour mark, we advise you to sit down on your bed and gently remove your compression garment. And at that point, you'll have noticed that any leakage that you've had from your liposuction procedure is likely finished. It's probably been absorbed by the padding that we put in your compression garment. And at this point, you can carefully, with assistance ideally, walk to a shower and take a gentle shower and kind of get back to feeling more like yourself. We do recommend that you test the water temperature with your hands before you get in because it's normal to have some numbness or some paresthesias or difficulty feeling or sensing temperature and other things right after your liposuction procedure. So to avoid getting burned in the shower, it's a good idea to test the water with your hands or another part of your body that has not had liposuction. In terms of any discomfort from the liposuction procedure, this usually peaks at the time that the swelling peaks, so at about 36 hours, and this really isn't intense pain. Most people describe the discomfort after liposuction as being similar to what they experience after an intense workout, so this really works itself out relatively rapidly. This can be variable. Some people do report some discomfort up to about 2 weeks, but for the vast majority of people, they are very much able to get back to their work routine after just 48 hours. In terms of getting back to the gym, again, using the Friday liposuction as an example, we usually find that people can return to gentle workouts by the Wednesday following their procedure, and they can really get back to performing their full workout routine about 2 weeks after their liposuction procedure. We'll generally have you come back to our office 7 to 10 days after the procedure to have your sutures removed, and this is not something that's painful. You'll just feel a little pulling while we take the stitches out, but this is not something that's really uncomfortable at all. After your stitches come out, it's also fine to take baths again or to go swimming again and submerge your incisions once they are completely healed. And this, again, generally is once your sutures are out, but this is something that we'll talk about at that appointment. And if it looks like things do need a little bit longer to heal, we'll give you an estimate of when it's okay to submerge your incisions in the bath or in a swimming pool again. Another nice thing that happens when your incisions are completely closed is you can start applying scar gels, and this will help with their healing in as inconspicuous a manner as possible. And there are several different products that we like that we can talk to you about during your consultation, because we do make different recommendations given whatever the specifics of your individual wound healing situation is, your skin type, and what we think will be best for you. We're also frequently asked about the necessity or the usefulness of lymphatic massage after liposuction. This is also something you'll find a lot of conflicting information about on the internet. We generally advise our patients that it is not necessary to have lymphatic massage after their liposuction procedure. These can be uncomfortable and they can be costly, and we just haven't seen data that they significantly impact the ultimate results of the procedure. For someone that does want to do something to augment their recovery process, perhaps to help the swelling resolve a little bit faster, or to smooth out the little lumps and bumps that often occur after liposuction but do resolve themselves over the longer term, there are a couple different things that we do like to recommend. One of them is M-sculpting, which we've talked about in earlier episodes, which is primarily designed to build muscle and burn fat, but we also find it does help to accelerate the liposuction recovery process, as it really works the swelling out of the area and it can help you get to see your results a bit faster. And another technology that we really like after liposuction is M-tone, which also we've dealt with in an earlier episode, but essentially between its mechanical therapy and radiofrequency energy will also help you see your results a bit faster and perhaps feel a little more comfortable after your procedure a little bit faster. And in terms of deciding between M-sculpt and M-tone, this again is a patient-specific recommendation that we can make after your procedure, and we see exactly how you're doing in your specific case. In terms of when you can expect to see your final results after your liposuction procedure, we generally advise people that they'll look almost exactly the same as they did before surgery for a week to 2 weeks after surgery, because you're going to be pretty swollen after your liposuction procedure between your body's natural inflammatory response and the numbing fluid that we introduced as part of the procedure. So it takes about a week or two for you to kind of equilibrate and get back to normal. And after that, you'll usually start to see some really nice changes occurring. But it really can take up to 3 months, or in some cases even 6 months, to see the absolute final result of your liposuction procedure for all of your swelling to work itself out, for all of your natural tissue contraction to occur, and for your body to really come into its new final shape. In terms of what you should be eating and drinking after your liposuction procedure, we recommend a relatively high protein, low salt, and low alcohol diet after your procedure. And this is primarily aimed at helping your swelling resolve as rapidly as possible to get you to your results and to get you to be as comfortable as rapidly as possible. To maintain your results after liposuction, we recommend maintaining the same diet and exercise program you had before your procedure to make sure that you're not gaining weight, because your liposuction results will be fairly permanent as long as you're not gaining a significant amount of weight after your procedure. We're also frequently asked if sleeping position matters after a liposuction procedure. And the truth is, you should really just focus on sleeping however you're comfortable. The one exception to this is if you're having a fat grafting procedure in addition to your liposuction procedure, then we might advise you to sleep or sit in certain positions to avoid putting pressure on your fresh fat grafts. And there is additional information on fat grafts in earlier episodes as well. We find that recovery from liposuction is really mostly about common sense, and we always encourage our patients to keep in close touch with us about any questions or concerns that they may have after their liposuction procedure. Thanks for listening, and don't forget to subscribe, share the show, and head over to DarrenSmithMD.com for more real-world plastic surgery